Okay, so going out for a walk, trying to get some fresh air. It's been a hard day emotionally, so just trying to get a mental health walk in. And of course I changed my mask finally. Felt like probably a week with that same mask on that I had at the airport or on the airplane was probably not a good idea to keep breathing in all of that crap that was on the mask. This is my only other mask, so I am basically, that's it. So hopefully I will be out of here in a week and can actually get home without having to do a mask. So I decided I had to make an educated decision today, since I'm not really getting medical treatment from anybody and the physician is hiding my x-ray, my chest x-ray, and I wasn't really sure what my chest pain was from. I had to make a decision. I left my Plaquenil on the airplane because we were considering giving doses of Plaquenil to our fever patients because we knew that they had been experimenting with that, but I didn't have a dosage, and so we decided not to actually give anybody medication that wasn't their own. So anyway, I left the Plaquenil on the plane, and that's probably what I would have used in this case with my chest pain, because I do get a pericardial effusion at times when I have a lupus flare, which is basically fluid that goes around the heart. There's a little tiny piece of covering that covers the heart, and in between the cover and the heart sometimes you can build up fluid. It's called a pericardial effusion. It's painful. It's not a very pleasant feeling, and unless it gets really bad, it's not really a big deal. So mine usually go away on their own, or I get some doses of prednisone. Prednisone is not recommended in the COVID-19 virus, or in general for viruses in general, but I'm not sure that my headache and my chest pain are actually viral related. I know everybody's like saying, oh, it's definitely virus symptoms, but I'm not actually convinced of that because I have the other going on, and whenever I drink sodas, I usually get a flare of lupus. Diet Coke, Diet Mountain Dew, any of those kinds of things. And because of the stress, I've been drinking more of those sodas. I have not been doing a very good job of staying on top of my my lifestyle, and drinking those sodas will definitely cause the pericardial effusion and the headaches for me. So I made a calculated decision, and I took a dose of prednisone today, which I went ahead and looked up the studies that were saying not to use cortisone and not to use anti-inflammatories, and made a calculated decision that although the risk of having a secondary bacterial or fungal infection because of the immunization suppression of those drugs, that the immediate effect on the inflammation, whether it was COVID related pneumonitis or whether it was lupus related inflammation, that because they're not releasing my x-ray for 2 more days, nobody can find out what was on my x-ray for 2 more days, that the immediate benefit of the prednisone is a calculated risk I was willing to take, because the effect of having a secondary infection wouldn't happen for a while. So it would give me a couple extra days, and that was kind of worth it to me. So yeah, so that was basically, it's a calculated risk. If I were the prescribing doctor, I'd probably would want to see the lung x-ray before I actually decided to take it. But I can't get that x-ray released. So our medical system crippled by the panic. And let me tell you, these people that are fighting the virus, they were fighting the virus before the panic started, and they were doing just fine. It was not the virus that crippled our medical system. It was the panic that crippled our medical system. From what I've been told from doctors that were treating in the ERs, they've been seeing the non-A, non-B flu for a really long time that came with the pneumonia. So this is a direct result of the panic, not a direct result of the actual infection. So anyway, that's my calculated risk for the day. And I'm taking a nice little walk and trying to get some mental health time. And I've been laying in a bed so long, cooped up. So getting out is actually pretty amazing, to be able to breathe some fresh air and stay away from people, because I'm not using the N95 mask. I am no longer comfortable picking up a water or anything like that. So we were able to get squared away, so anything that I need is just getting delivered to my door, and basically just staying away from everybody at this point. So I'm up and about. I will have to wait and see. Usually the prednisone takes effect within 24 hours for me, and I feel way, way, way better after that. So the telltale sign will be tomorrow when I make my update and tell you how my calculated risk goes, whether it swings in my favor or whether it was possibly a really bad mistake. But hey, you know, nobody else is stepping up to the plate to make those decisions. So, and I'm not really trusting people right now. I wonder why. I'm having a really hard time trusting those that are supposed to be making decisions in my best interest. It's kind of, this panic has kind of made a thing of, you know, look after yourself, you know, take care of yourself. Those words mean something very different to me now. Just making sure those kids don't get close. But those words mean something totally different to me now. Take care of yourself means basically you guys go to your houses and look after one another, and unless you guys need a ventilator, don't call us. That's pretty much the word on the street I'm getting, that you're pretty much on your own unless you need a ventilator. So sad state. I hope that this is not one of those moments that we look back in history and hang our head in shame like we did in Vietnam. But time will tell, guys. Time will tell.